Hi, Dr. Adam Miller here from Arise MD with an update on COVID care for all of the Arise citizen scientists out there. And this is really meant to be a little bit more intimate message for those of you who are patients of our practice or have come through here with family members as patients, to let you know that we have recently received the backing of the FLCCC Alliance. That's the Frontline COVID-19 Critical Care Alliance group. It's headed by Dr. Paul Marik, and I'm thrilled to be a part of this alliance. Not only are there just amazing, really intelligent clinician colleagues out there, but right now, as this virus evolves and the understanding of how to care for it continues to evolve on a weekly basis, we really feel like we're knit into that frontline group. And I'm just so grateful that they're responsive to the questions I've had regarding patients from our practice, some of whom have gotten really sick. And we've been able to keep, to this point, everyone out of the hospital. So there's a few key points that I want to cover with you tonight so that you are up to date on how we at Arise MD are approaching the treatment of COVID-19. And the first take-home point is that this is a phased disease. I want all of you to think of this in two phases. So if someone says that they have, they tested positive, the first question is, are you in the viral phase or are you in the pulmonary phase? The viral phase lasts about 1 week. So I think of week one as the viral phase, week two as the pulmonary inflammation phase. If you have symptoms, if you start having symptoms today, you should assume that you were infectious 2 days before and about 8 days afterwards. In the studies that Dr. Marik was involved with, no one was still contagious at day 9 after starting their symptoms. Keep that in mind. So in general terms, week one is viral. That's when you want to hammer the antivirals. 6 grams of vitamin C, 5,000 IUs of vitamin D, your quercetin at about 2 grams a day, zinc 50 to 75 milligrams per day, and a prescription for ivermectin, about 12 milligrams taken on day 1 of symptoms and then 3 days later. And there's been a movement towards continuing ivermectin into the inflammatory phase because of its anti-inflammatory properties as well. Week 2 starts the viral debris pulmonary phase. This is where inflammation can kick up to a point that we have what's called the cytokine storm. And we've seen some examples of this in the practice. There's 2 elements to this week 2 inflammatory phase that we need to be very cautious about. One is the actual inflammation, and we measure that with CRP as well as the clinical exam and a laboratory test called SED rate, in order to determine whether or not we need to initiate the very potent steroid methylprednisolone. Okay, so the inflammation, and the other part is clotting. Looking out for and avoiding those micro clots in the lungs that in combination with the inflammation can produce what's called the happy hypoxic. And we had a patient here from out of town we were treating who was a happy hypoxic, and it's one of the most bizarre things I've ever seen clinically, because this gentleman walked in very, very grateful for all the care that we've given him remotely and feeling so much better than he did the week before. But yet in the clinical chair here doing my exam, I see a pulse oximeter reading only around 90 to 92%. His resting heart rate is way above normal at 100 to 110. And I can barely hear the air moving through his lungs. And yet he is sitting there happy as can be, full of good energy, bright-eyed, and singing our praises. This individual then was started immediately on methylprednisolone and was then started on Eliquis, the prescription anticoagulant. Of course, at that point, we stopped the aspirin that he was on. So number one, this is a phased disease. Number two, you have to treat in phases. You don't want to be overly aggressive during the viral phase in week 1 with your anti-inflammatories. You want to be aggressive with antivirals then. You want the body's inflammatory response to be strong so that you get a small viral replication load, which hopefully leads to a small amount of debris, which hopefully leads to a very small immune response and avoidance of that cytokine storm. Number 3, be aware as you move into the early pulmonary phase and the late pulmonary phase. In this day 14, I have found to be a very critical period of determining whether or not somebody's going to hit a recovery plateau, during which time you're tempted as a clinician to remove or quickly taper the prescription anti-inflammatories and the anticoagulants and start to get the patient back to normal. Because what we're seeing and the Alliance is seeing throughout America is a increasing number of people who are having a rebound or a backsliding once they plateau. What's the key to avoiding the backsliding? Clinical exam and laboratory testing. A chest x-ray if needed, but a CRP and a SED rate and a CBC and a D-dimer are critical during week 2 to avoid the plateau and the backsliding. So underscoring laboratory monitoring and physician monitoring once you start to move towards the end of week 1, it's critical. It can make the difference between you having long-term scarring and energy issues and slow recovery and having a quick recovery and getting back to normal. And then the last key take home here is that clearly you need to be prepared. At home, you should have a blood pressure cuff, a pulse oximeter, you should have a thermometer. I recommend you have a nebulizer at home. And then you don't need to rush out right now and get a home oxygen converter. But know that we have done some legwork here at AriseMD to build 2 pathways to efficiently get our citizen scientists the home oxygen they need within 24 hours. So should you start to need oxygen, we don't have to send you to the hospital to get that oxygen. We can get it to you at home quickly. The other thing I want to mention is that pharmacies have started to give us real pushback. In fact, they have denied filling prescriptions for ivermectin or hydroxychloroquine and have even questioned some of the methylprednisolone scripts. Therefore, we've been able to find more accommodating partnerships to make sure that all of our patients get ivermectin when needed and get the steroids when needed. All right, so those are the key up-to-date take-home points. Please take some time to listen to this, pass it on to your family members if needed. And if you have questions, info@arisemd.com. You need to be monitoring yourself at home. And as soon as you have symptoms, you need to be doing daily vital signs, and then you need to get a hold of us and let us know where you're at. First thing I'm going to ask you is, what day are you? And I'm going to remind you what phase you're in, either viral or inflammatory, and guide you on whether you need to be in the office for an exam, for laboratory testing, for IV vitamin C, for all of that. And if you follow this plan with us, we can keep you out of trouble and avoid that long-term post-COVID syndrome that so many people dread. Take care and God bless. I'm Dr. Adam Miller from AriseMD.